Hello, my name is Dr. Olawale Ogulano, and today let's talk about cervical cancer. When we talk about cervical cancer, we are talking about the second most common cancer in women living in developing countries, and also the leading cause of cancer-related death in women living in developing countries. It's also the fifth most common cause of cancer-related death globally. Why is cervical cancer less common in developed countries and more common in developing countries? This may be as a result of the fact that screening tests for cervical cancer are usually performed as a routine test in the developed world. But we'll get into that later. The cervix is the lower portion of the uterus. It's about 2 inches long and is tubular in shape. The function of the cervix is to allow the flow of menstrual blood from the uterus into the vagina, and also helps to direct sperms into the uterus, or the womb as we call it, during sexual intercourse with help of its secretions. So, I think the first question we will ask is, what causes cervical cancer? Cervical cancer is caused by the human papilloma virus. With over 115 types, it has been proven to be a known carcinogen or a cancer-causing agent. There are, of course, several types of the human papilloma virus. However, 3 particular types, the 16, 18, and 45, cause 94% of all cervical cancers. But let's not go too deep into that. Now you'll be asking, oh, so doctor, infection, virus, what causes it? How can I get it? Well, the thing about the human papilloma virus is this: there are different routes of contacting the human papilloma virus. However, the major incidence of cases that we get to have contact the human papilloma virus is through sexual intercourse, kinky, that kind of a thing. There are other things that can put people at risk as well of contacting the human papilloma virus, especially for men. This also covers men. Multiple sexual partners. Guys, how far now? But wait, remember, we are talking about women and cervical cancer. That doesn't mean men cannot carry the human papilloma virus. Hello guys, this thing is a Bluetooth something. People who began sexual contact at a very young age, they are at risk of contracting the human papilloma virus. And then people with a past history of STDs or sexually transmitted diseases, which is why you should use a condom. And if I remember correctly, Aproko Doctor has already spoken elaborately about condoms and why you should use a condom. If you haven't, you should watch that video. So you have people living with HIV at risk of developing cervical cancer 5-fold because of the fact that the human immunodeficiency virus impairs their immune response or their defense systems. So they are much more at risk of contracting the human papilloma virus. Now, here's the funny thing. In developed countries of the world, women diagnosed with early stages of cervical cancer usually do not present with any symptoms. But here in developing countries like Nigeria, where every single thing is a fire brigade approach, turns out that a lot of women come in the late stages of cervical cancer where they begin to manifest symptoms such as bleeding after sexual intercourse, lower abdominal pains, vaginal discomfort, foul smelling or malodorous vaginal discharge, and weight loss. And in the later stages of cancer, that's cervical cancer, the liver, as well as the bone, they can be affected. This is why screening is so important. So I've been talking about screening since morning. Doctor, which screening are you talking about? I was privileged to go on a little road trip just some days ago. And here's what I found out on the street when I decided to ask people if they knew something about cervical cancer and Pap smear. Have you heard about cervical cancer before?
Yes.
Have you? Okay. Have you heard about Pap smear? Do you know what a Pap smear is? You've not heard about it before.
No, I don't
Or have you heard about cervical cancer before? Have you heard about a Pap smear? Do you know what a Pap smear is?
Yes.
Have you done it before? Okay, now the screening test that I've been talking about is called a Pap smear, or in full, the Papa Nicolau smear test. Sorry, don't break your ears on that one. Collected cells from the cervix are usually stained on a slide, and they are evaluated via microscope to find out if there are any abnormalities. If abnormal cells are detected on the Pap smear test, further clinical tests such as colposcopy may be indicated, as well as a cervical biopsy. Now I'm sure you're asking, so what happens, doctor, if I have cervical cancer? Well, the treatment of cancer is usually quite complicated. The treatment for cervical cancer will comprise of a team of medical specialists. So you have a gynecologist, a radiologist, an oncologist, just on your case. And you'll be asking, doctor, only me? But that's the truth. Because the treatment of cervical cancer in its late stages is quite complicated. Why should we complicate something that can actually be prevented, if you're asking me? Yes, the fact is that cervical cancer happens to be among the preventable cancers. Yes, you can prevent cervical cancer. And how can you do that? By taking vaccines. Vaccines are available for the prevention of cervical cancer. So the vaccines are available for the girls as well as for the boys. Yes, it's available for the boys so that you can stop sharing the virus around. Come on, you're not Santa Claus. So stop sharing virus. We don't want it. Thank you very much. All right, these vaccines are available in different hospitals, so make sure you consult your doctor to find out more information about this. Thank you for watching this video. Did you like it? Then share and subscribe. And if you like what I'm wearing, check the link in the description below and get your own copy. Thank you, and see you in the next one. Bye.